It is very important for smokers to understand that COVID-19 pandemic is a boon for them, and it is one of the best time for them to think and perhaps quit tobacco. The reason is that we have ample evidence that people who smoke, people who use tobacco in any form, they are more likely to get COVID and COVID related complications. In many of the Western studies, the mortality has been very high amongst those who are using tobacco due to COVID 19. During COVID 19, the availability because of the lockdown is a problem. Then going out to smoke is also a problem. Being at home with children, you are not encouraged to smoke, and therefore all this leads to a big problem in people who are using tobacco and in any form. And therefore, there is a reduction in the smoking and tobacco use amongst many people who are former users. This has given them the courage that reducing is a possibility, stopping is a possibility. Now, second important thing people must understand that once you are able to quit tobacco for a period of 6 to 7 days and overcome the withdrawal symptoms, then you have a very good chance that you will remain a quitter all your life. The first 6 7 days are only the problem, and those are because of the nicotine withdrawal, which leads to uneasiness, drying of the throat and mouth, then tachycardia, restlessness. These are not something very serious, but people are not able to really overcome all those withdrawal symptoms, and they go back to smoking to control that. One should also realize that increasingly smoking and tobacco use is being looked down upon. That means that it is no more cool, and it is no more something that is giving you a macho feeling or giving you an impression that the person is very smart and very intelligent and perhaps very cool. Most people, they realize, even people who employ, they look for people who are non-smokers, non-tobacco use, because it's a big risk for an employer to have a staff who is a tobacco user, because then we know that the productivity, stamina, output is lower because of the many health issues. And perhaps if you have to give insurance to them, then it is a big burden, financial burden on the industry. So for all these reasons, it is better that you remain healthy, you remain productive, and that is the way every family is looking for and every employer is looking for. Now, at a national level, whenever people are talking about tobacco control, they always say that why don't you ban tobacco? The issue is not about ban. There are 27 crore people who are using tobacco, and unless they decide to stop tobacco, unless they decide not to have tobacco or reduce tobacco, that means unless there is a supply reduction, it is unlikely that we will really make a huge difference by stopping the tobacco cultivation or banning tobacco. So COVID-19 pandemic is an opportunity where people can reduce their consumption. Once they reduce their consumption, it is likely that even production will go down, cultivation will go down, and then we can look for a world where tobacco is not being available for our future generation. And we must understand that the income from tobacco is only 11 to 12% of what is lost from tobacco. Now, loss from tobacco, in 2014, Ministry of Health conducted a survey. It is up to 1 lakh crore, and the revenue through excise was just 11 or 12,000 crore. So it is not a good situation even for the country for having tobacco product in the market, because we lose more than what we earn. So again, I would urge and request all those who are using tobacco to consider stopping tobacco or reducing tobacco towards ultimately stopping it after a few months. So this is the message that I would like to give to everyone on World No Tobacco Day 2021. Thank you so much.